happens when your body's best defense system starts following the wrong orders. We know that inflammation is supposed to heal us, but in autoimmune conditions, that fire doesn't just stay lit. It starts attacking the very things that it was built to protect. Today, we're going to be looking at why that happens and how we can help our body to find balance again. Living with an autoimmune condition often feels like a balancing act between managing symptoms and the medications used to treat them. But what if there was a way to support that plan from the ground up? So today we're talking about the role of inflammation in conditions like RA, Hashimoto's thyroiditis, and how you can work with your body and your doctor to truly find relief. The immune system is like a police force, patrolling the body, looking for anything that might be dangerous, and restraining or eliminating it. Body tissues are usually identified by specific protein markers that are on the cell surface. Sometimes these markers are similar to pathogens or disease-causing organisms. In the autoimmune conditions, the body's police force gets confused and starts attacking the body's own system. We don't know always what causes this to happen. So conditions like rheumatoid arthritis, where the body is attacking the joints and other organ systems, Hashimoto's thyroiditis, specifically it's attacking the thyroid, or psoriasis, where a lot of the attacks are against the skin. We don't really know what's causing it, but we do see that the immune system just gets overzealous in its protection, leading to these specific friendly fire situations. We talked in previous videos about the concept of inflammation. We know that acute inflammation can happen as a result of some kind of tissue damage like an injury, and this is necessary and appropriate part of the healing process. But when that inflammatory response continues and it becomes chronic, then it becomes an issue. In the previous video, I talked about how that can impact the heart health. This chronic state of high alert inflammatory process can damage potentially organs like the kidneys and the lungs, joints, or nerves over time. Some of the conditions I mentioned, rheumatoid arthritis, well, that's really a misnomer. It doesn't just attack the joints. It also can attack the lungs and the kidneys. Hashimoto's thyroiditis, attacking the thyroid, and lupus. Lupus attacks the kidneys, and you also see a skin rash with that. We don't always know what suddenly triggers the immune system to go on hypervigilance and start attacking those body's own tissues. We do know that inflammation can exacerbate that problem. Some of the things that keep inflammation fueled, things like stress, poor gut health, environmental exposures, or dietary nutritional choices. Genetics also can play a role, but we do have control over these other external factors. If you've been diagnosed with one of those autoimmune conditions, your doctor may have prescribed medications like immunosuppressants or corticosteroids to help manage your symptoms. And these are necessary to put out the fire, so to speak, of inflammation and prevent further damage to your body tissues. What we're talking about today is not replacing those tools. It's about supporting the whole plan. So you could see we've got here some different pillars of health to help with reduction of inflammation. There's a lot of good anti-inflammatory support measures, but always make sure you check with your doctor or pharmacist before you add anything that could potentially interfere with your medication protocols. Make sure to also ask them about any specific concerns about your condition that you might have. So in the area of nutritional support, we have some good anti-inflammatory co-pilots to help us. Adding omega-3 fatty acids to balance your fatty acid profile. Of course, ideally, we would like it to be a 1-to-1 ratio between omega-3 and omega-6. So that usually means supplementing with omega-3s. You can also add turmeric and ginger to help decrease inflammation. Those are just regular spices and they are delicious. Turmeric is the really bright orange spice. You see it a lot in curries. Sugar promotes inflammation, so you want to make sure that you reduce your consumption. A good way to tell is for 2 weeks, keep track of everything you eat and drink and see if you can identify any patterns. A quarter of a cup of berries daily is a good intake of fruit to help inflammation and keep sugar levels under control. Fiber helps to block the absorption of sugar, so you can get as many of the raw veggies as you can. And of course, the more colors you eat, the more of those essential enzymes and micronutrients that you get, and that's great. Sometimes there's imbalances in gut bacteria. Functional medicine doctors can assess those with lab work, so that might be a good thing to look into as well. The nervous system is an important part of managing inflammation, and we've talked about heart rate variability before. And chiropractic care can help you manage spinal stress and also improve heart rate variability. So this heart rate variability, it's a measure of how your heart is adapting to changing conditions, and it indicates a healthy nervous system response when you have a good level of heart rate variability. You can also improve heart rate variability and feel better with meditation and breath work. Let's try one of those breathwork exercises now. So we're going to do box breathing. It's called box breathing because there's 4 phases, so it's kind of like a box. So the first phase, we're going to inhale for a count of 6, and then hold the breath for a count of 6. Then exhale slowly for a count of 6. And then hold the breath out for a count of 6. And you would repeat this cycle for several times. This helps to lower cortisol levels that often fuel those autoimmune flares. There's some great research on the meditation and breath work. I've actually put together a class incorporating both of those, so several breath work exercises and a guided meditation. I've put the link in the description for you. Another important aspect is strategic movement for joint and tissue support. Now, especially anybody who has an autoimmune condition that impacts the joints, people who are on their feet a long time or they work long shifts, it's important to make sure that you're well supported. A lot of my patients who are service workers, even if they don't have an autoimmune condition, they wear Spanx or support hose, and those can really help. You can also use tape to support your feet. Now, I use in my office, and I really like Rock Tape, which is the stretchy kinesio tape. There's lots of different brands. This is what it looks like. Of course, they have many cool patterns. I just like this Argyle one. It's on a paper backing, so that's why it's not very stretchy right now. When I take off the paper, then it becomes stretchy. So if I wanted to tape my feet before a long shift of work on my feet, imagine if this is your foot. So here is the body of the foot, and then we have the toes here. Just imagine. So the first thing you're going to do is stretch your toes up. So your toes are pointing up, and then you're going to run the tape from the heel up to the base of the toes. Don't stretch the tape. You're stretching your foot at this point. So lifting the toes up, stretching the foot, and place that tape down and rub it a bit so that you activate the adhesive. The next step, you're going to cut some little strips that go across, and we want to round the ends, by the way, so that the little corner pieces don't get stuck on things. So you're going to put the tape across. This one's way too long, but you can imagine it's going to go like this. You might have room on the foot for 1 or 2 strips going across. Now, we want to stretch it about 50% in the middle of the tape, but don't stretch the ends. And you're going to stretch the tape. Now you can relax your foot. You're going to stretch the tape, but not the ends. Stretch the tape, but not the ends, and rub it a bit to activate the adhesive. Now, this Kinesio tape of whatever brand or flavor that you get, it will last several days. So you don't have to take it off at the end of the shift. If it's irritating you and you want to remove it, don't just rip it off. You can soak it, or even better, put like some lotion or something a bit oily to soften that adhesive before you try and remove it. Otherwise, you can leave it for several days and it will still stay there and support your foot. When you get done with your work shift, make sure you stretch out your feet and your legs. And I like to recommend something I call ankle alphabet. So you stretch your foot out and imagine you're tracing the letters of the alphabet with your big toe, one side and then the other side. You can also use a nice squishy tennis ball to just roll your foot over that, to just stretch out the foot, and gentle yoga stretches. You can easily find different examples of yoga stretch routines on different video platforms and so forth. If you have some kind of joint-related condition, like RA, supportive footwear is very important, even at home. When you're in the house, if you don't like to wear shoes, you can get some nice slippers. I like ones with good, strong rubber soles so I can go out into the garden. They have good traction as well. So that's really important. Sleep hygiene for hormone support. This means organizing your environment to optimize your sleep. So you want to lower your stress hormone cortisol levels at night. See, cortisol is supposed to go down, and melatonin, the sleep control hormone levels, are going to go up. So we want to support that process. Make sure you turn off bright overhead lights 30 minutes before bed. I actually got a special light bulb that doesn't have blue light in it. It actually looks kind of amber and, spooky. I really like it. For my bedside lamp for reading, I use that so that I don't get more blue light. See, blue light stimulates the brain and it can interfere with sleep habits. So you turn off all the screens and any bright lights 30 minutes before bed, and that's going to help you sleep better. Likewise, when you wake up in the morning, within the first hour of getting up, you want to make sure that you have nice bright light exposure. And since I don't always get outside right away, I actually purchased a full spectrum light to set up in my bedroom while I'm getting ready. So melatonin at night to help you sleep. You want a nice cortisol spike in the morning when you first get up. So that nice bright light is going to help you with that. Inflammation isn't always the enemy. It does help with tissue repair. Uncontrolled inflammation is what we really want to address. And so you've got some ideas for that. Make sure you put in the comments any suggestions for future topics or questions that you might have. Tell me something that you have found helpful in managing your own inflammation flares. Make sure and like and subscribe for more deep dives into natural health ideas.